Hi, this is Five Questions with an ISHLT member, and I am Jess Burke, Director of Marketing and Communications with the International Society for Heart and Lung Transplantation. And I am here today with Scott Silvestry from the Cardiothoracic Surgery Professional Community. Hi, Scott.
Hi, Jess. How are you?
I am super well. It's great to talk to you. And before we dive into our five questions, it's technically six because my first question for you is, can you introduce yourself, share who you are, what you do, and what your role is with ISHLT?
Absolutely. My name is Scott Silvestry. I'm a cardiac surgeon. I like to think of myself as a cardiac transplant surgeon in Orlando, Florida. And I have been here for 7.5 years. I've been a cardiac surgeon for 22 years after training. And I have been a member of the ISHLT now for approximately 15 years. I was introduced to the ISHLT by Dan Morelli, who was my mentor in heart transplantation at Jefferson in Philadelphia. And he said, you have to join this because this is where you will learn everything important to our field and where you will meet everybody who helps us learn what to do. And so, of course, I listened to him and I joined the ISHLT. And I have served on a variety of committees and memberships and provided education and lectures and presented papers and been privileged enough to have been part of the leadership structure at various times, advisory and others, as well as the mentorship program, which I think is one of the most important things that we do. And lastly, most recently, in the iteration of the foundation, to be part of the team helping enable people like me and people like everyone in the ISHLT give back in some way according to their ability and desire so that this goes on in perpetuity.
Well, I think that sounds great. Thank you for everything you've done for ISHLT over the years. You kind of answered a little bit of my first question already, but I'm going to ask it anyway. Um, you talked a little bit about what got you involved in ISHLT. I'd like to know more about that if there is more, but also what keeps you here? What keeps you involved over the last 15 years or so?
You know, it's really funny, like reading a book over and over again at different stages in your life, organizations help you provide structure. And when I was new and a new director of a heart transplant program, not really knowing what I was doing, but sure that I was doing it well, the ISHLT gave me connection and gave me content in order to help me see what other people did and gave me a meeting where I can go and walk up to people like Yoshinaka and ask Yoshi about a case or a question or running a program, talking to new leaders now who are starting their own programs and the rest, looking at places where we connect, because a lot of the things that we do that make us effective in delivering care to our patients aren't really learned in textbooks and they're
Mhm.
not really taught in residency. And so the ISHLT provides that platform for us to stay learning and teaching in ways that value our experience and help us develop that experience. A new leader for a transplant program called me up and was asking me about this. And I said, you know, we should have a program. We should write a proposal for the ISHLT that is called Starting Your Program,
Mm.
what to do, what not to do, and to have people who've all done it at various stages of success and failure as part of it. And that's the other part of ISHLT. It's a dynamic educational platform that gets 95% of its content from the members as to what their needs are and how they can connect and facilitate. And so those are the reasons. And for that, I will always be part of the ISHLT, the community, and it'll always be part of the year that I look forward to most is that the national meeting and part of the interactions.
Well, I love that your answer to that question generated an idea I'm going to take notes on. So I think that's great. And you're right. It really is about getting everybody from all the stages in their career together. So I'm glad that that's resonated for you. Um, Talk a little bit about your career. What inspired your career path? You talked about being a cardiac transplant surgeon. How did you end up one? What made you want to do that? And how do you stick with it over the years?
So it's interesting. My brother's a cardiologist at the University of Pennsylvania, and he runs the fellowship program. He's a dedicated teacher and a fantastic clinician. He's not a transplant person, but that's okay. No one's perfect. Our grandfather was a Russian immigrant, and he started on 7th Avenue in New York and then worked up and saved up to have his own haberdashery. And so if you look at pictures of my brother and I in the 1970s, we're like little old men dressed up with hats and overcoats and suits
I've got to see one
and,
of those
and all
pictures,
this.
Scott.
They're phenomenal. They are phenomenal. But my grandfather said to my brother and I both that if you're a doctor, you help people. And if you're a surgeon, you work with your hands
Mm.
and you earn an honest living. And so my grandfather, who died of hypertension and a stroke, really set a tone for both my brother and I, my older brother and I, to go off into cardiovascular medicine.
Mm.
And I was really struck as I was training at Duke with the possibilities that existed with working in cardiac transplant and thoracic transplant with role models and mentors like Dwayne Davis and Carmelo Milano and Peter Van Trite, and just the possibility of what can be done. It turned out to be a fortuitous decision. And although I initially went off into private practice in Upper Michigan, I came back to it 2 years later and really found a home. It's transplantation is a unique physiologic problem. The cardiovascular disease is unique challenges, and we were sort of at the epicenter of several tremendous paradigm shifts, both with centrifugal continuous flow LVADs and bridging, and then ultimately the DCD transplantation. And so all of these things happen with a background of communication and connection through connections to ISHLT and the rest. But the career has really has started with a desire to make my grandfather happy and to honor his memory, and ended with a tremendous reward and ability to impact patients.
I love it. I've asked this question to over a dozen members now, and a lot of people talk about familial connections, but I'm pretty sure that's the first time the word haberdashery has been used in that answer.
Great.
So thank you for that. So tell me a little bit about, is there a meaningful milestone either in your personal career, something you've achieved, or in the field, something you've just been really happy to see that you want to share or mention?
So one of the professional milestones was, Carmelo Milano and I had conversations over the last 7 years about DCD, and seeing DCD come to heart transplantation has been a phenomenal boon, and something that many of us in the field have been pushing and waiting for. And some of us, because we're in the United States, have been on the sidelines until recently. And so in a lot of ways, seeing that come to fruition has been very fulfilling. The advances in mechanical circulatory support, which I am a big proponent of, have really been important. But when you put those things aside, professionally, having spent time at Washington University in St. Louis and watching what happens when you empower young physicians with a voice and with a platform, to watch them grow and see the things that they do is the multiplier effect. Physicians like Susie Joseph, who was my work wife then and now, Shane LaRue, and Mike Nassif, who published a phenomenal amount, and seeing the culture that they then went on to create of inquiry, fueled by passion, but looking at data and seeing data-driven results come to our community, which is a small community, has been plagued by personal bias and less data and more. And again, the ISHLT has factored in this because young faculty have always found a place to present. And I have never been more proud of anything that I've contributed to than sitting there watching at WashU when we had something like 20 presentations at a meeting, and seeing medical student and resident and fellow come up and present important pivotal data. We had one of the center papers at the ISHLT that one of my fellows presented, Jason Roberson, and the reception that he got and the reception that we got in this platform is what fuels the continued passion in this domain. Answering questions with data through ISHLT and through Intermax and through UNOS with young people has really been my own personal milestone for my career. I never really thought that was possible. You train in very sort of egocentric places and it's about the individual, but then you see what's really possible as a team, and it really awakens a tremendous feeling for the field.
So when you look at the work those young folks are doing and you think about your specialty, what do you see on the horizon? What's the future for cardiac transplant surgery? What are you seeing coming down the pike?
So I think a lot of the future for transplant surgery is the future of medicine. And you
Mm.
think about people like Evan Kransdorf at Cedars-Sinai, where, it's amazing because you have a parallel idea in two different places where two different people never spoke, but when they meet at a meeting, and happened to be, in this case, I think it was in Boston, and talking about this idea, we see. So I think the tools of technology, we talked previously off about the 15-year-old in the IT department, the tools of technology and teaming are being applied to boutique specialties of heart transplantation. So I might do 70 heart transplants this year and someone else might do 20, but how do we equalize that playing field so that the information is franchised across so good decisions are made? So with the applets about heart matching, or whether it is a standardization and lessons so that someone starting out or someone who's done 500 transplants can have the same ability to make decisions on their patient's behalf. That is what I see coming to transplantation, using bigger sets of data parsed down to small bite-sized levels, number one. And then number two, the heart transplant community has really pioneered teaming. The heart transplant team is what they took in TAVR, the so-called heart team, the multidisciplinary team. No one ever argued about how it was set up by Shumway and the others because they brought everybody inside. The Stanford fishbowl with the cardiologists and the surgeons in the same area, with a transparent conference room so everyone can see what's going on. Taking Dr. Shumway's legacy full forward to really applying the teams and the teams that we have is really what is going to take transplantation, heart and lung, to the next level. I will say that we have a phenomenal team here at Orlando, at AdventHealth Orlando. And as we add young people in the areas that they demand, that they innovate and they exceed their learnings. We have a saying in a Jewish textbook called The Wisdom of Our Fathers, and it says, "Now go and exceed your learning." And I actually wrote that in Hebrew on my graduation picture from Duke, because I figured no one at North Carolina at Duke would really be able to read Hebrew except for a couple of people. But that's what we see. We see people like Evan Kransdorf. We see people who are taking it to the next level and exceeding it and pushing the boundaries, driven by data, fueled by teams.
I love it. And I love that your answer about what the future of it looks like includes the past. I think that's really lovely.
Thank you.
So setting aside, your career and transplantation and all of this for a moment. I know we talked about this briefly before I hit record, but what are you doing when you're not doing transplants and saving patients? What's your idea of a perfect weekend?
Yeah, so people like me find it hard to unwind and completely disconnect. And we might be in Amsterdam walking with our family, and we get a call from a colleague about an opinion on a case, and that tends to make us happier than seeing Anne Frank's house or something like that. But when I am unwinding here in Florida, I enjoy spending time with my family. Obviously, I have a 13-year-old and a 15-year-old boys, and then I have a 22-year-old niece that's with us, as well as my wife. People who know me know that I play with Italian cars. And so I like to go in my garage where I have a full Zoom computer and sound setup, air conditioning,
Nice.
and refreshments if necessary, where I can go and tinker with some of my toys. I have some old limited edition Italian toys that I will play with, and then take them for a ride if the weather's nice with the top down, and just sort of enjoy some of the fruits of a productive life and some good choices. But that's kind of it. Obviously, spending time with my family, going for a drive with my wife with the top down to dinner on Park Avenue here in Winter Park is a perfect weekend. Of course, fitting in a transplant somewhere in there would be ideal, but I'll take the full weekend off.
I think that sounds great. What's the point of living there if you can't have the top down? So,
That's true.
well, Scott, thank you so much for taking the time to chat with me today. This has been great. Is there anything else you want to say to the IshLT community family that we haven't covered yet today?
No, I just want to, I'm grateful. I'm grateful, especially during COVID, and the connection that was afforded, and for the contacts and the ability to interact with my colleagues in such a place it's been a privilege, really. And as I said, I think all of the members should consider consider at all stages what they can give to their colleagues and the society, including through the foundation or through mentorship or education or scholarship.
Couldn't have said it better myself. Thanks, Scott.
Thank you.